Thank you, Mr. Secretary. And I believe that your effort and focus on making America healthy again and helping us to focus on nutrition and prevention and healthy lifestyles is one of the most significant things that you have done among the many that you described in your testimony. In that context, in your testimony, you identified nutrition as a bedrock of health and one of the primary levers for treating and preventing chronic disease. You also emphasize that it's imperative for our nation's healthcare providers to be equipped to incorporate nutrition into patient care. Securing commitments from more than 50 medical schools to provide at least 40 hours of nutrition education is an incredible start. I don't think it was very long ago that there was probably very little nutrition taught in medical school. And now we are encouraging that to be a focal point. How does HHS plan to build on this progress by securing additional commitments from medical schools and expanding nutrition education into other key areas such as residency training, medical licensing, and continuing medical education?
Thank you very much, Chairman. We're expanding the number of medical schools. There's already many, many others that have signed on since the original 54. We are working with the states, more than half the states on a MAHA legislative plan. More than half the states have already passed legislation requiring nutrition education and continuing medical education. We've now issued notices to all the hospitals in America that they must start serving nutritious foods in the hospitals. Something that, the food before that has been appalling. They're giving diabetic patients Jell-O and custard and a soda drink. And if they want to continue to get Medicaid, Medicare dollars, they need to change that now. And then we're driving good nutrition through the WIC program, through SNAP, through school lunches, through the Indian tribal services, and other federal subsidies programs as well.
Well, thank you very much. I will just tell you that I, for one, deeply appreciate that strong focus on helping us get focused on nutrition. It was a sad thing that our society had not focused on it as well as it should have until now. Republicans established the Rural Health Transformation Program in the Working Families Tax Cut Act to strengthen and modernize our nation's rural health care delivery system. We do have a problem in the rural health care system. And with this funding, we are hoping that states will be able to implement comprehensive strategies that not only expand preventive, primary, maternal, and behavioral health services, but also create new access points that bring care closer to home and stabilize our challenged rural hospitals. All 50 states received their first-year awards ranging from $147 million to $281 million. What do you think are some of the most innovative ways that states are now going to be able to work to transform their rural health care networks?
The states, the applications from the states were really extraordinary. We were astonished how resourceful and imaginative they are. Among, I think, the most common applications were to improve or to maximize the use of AI in diagnostics, in health delivery, and also just in billing and in management of the systems. A lot of the money is being spent on telehealth, which is going to deliver rural health care to areas that are particularly remote in this country, places like Wyoming and Alaska and many others, where health care just simply is not accessible. A lot of the applications for residency programs and for worker recruitment and retention, and then just allow for badly needed infrastructure repairs. We've lost more than 120 hospitals in rural areas since 2010. And it's a crisis when they lose that hospital. They're not just losing access to proximate health care. They're also losing the greatest economic driver in many of these communities. These are, in many cases, the greatest employer. They have the highest pay for their workers. And when they close, businesses stop moving to the area. So it's absolutely critical that we keep those hospitals open, and that's why this plan raised by 50% the amount of the infusion of federal dollars that is flowing to rural areas in this country.
Thank you very much. My time's expired, and I want to try to stay at these 5 minutes, so I'm trying to set a pattern here for the rest of the committee. And I had questions on telehealth and innovation and AI, as well as waste, fraud, and abuse. You anticipated many of those in your answers. Thank you very much. Senator Wyden.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.